Hi, everyone. Welcome to another episode of Coffee Chats with Claire. I'm super excited to introduce our guest today, Jill Sproul. She was a guest speaker in my anatomy and physiology class last year, and I'm so grateful that I get to speak with her again. She brings over 3 decades of experience in burn care and has dedicated her career to both clinical and community support. She began her nursing journey in 1990 at Santa Clara Valley Medical Center's Burn Center and went on to hold leadership roles, including Burn Center nurse manager for 20 years and eventually chief nursing officer. I'm really looking forward to hearing your journey and the incredible work you're doing in the burn survivor community. So thank you so much for joining us here. Let's start off with talking about your current role and responsibilities. Can you please tell me about your current role?
Sure. And again, Claire, thank you so much for having me. Um, it's always a pleasure to talk about burn nursing. It's my passion. And my current role is I'm no longer in the hospital and I work for the Phoenix Society. Um, After spending 33 years in the hospital, I retired. And my current role with the Phoenix Society is I'm the senior director of programs. So we work on programming and content and tools and resources to help people after they go home from the hospital with getting back to their life. Things on the physical recovery and, very importantly, the emotional recovery.
Can you share a success story or a positive outcome that resulted from your work?
Well, from my burn nursing career, I was a burn nurse for over 30 years and in various roles. But when I was a bedside nurse, I had the pleasure and honor of taking care of a young woman who was in a terrible car accident. There was a fatality. She survived. And not only did she have really significant burn injuries, she also had a lot of trauma injuries with broken bones, a head injury. So, because of her major trauma, in addition to her major burn, she lost both of her legs. And because of her head injury, people did not think she was going to survive. And if she did, she would not have a thriving life. And, what kind of quality, the question was what kind of quality of life she would have. Well, I took care of her every day for weeks on end. And I knew she was in there, meaning I knew she had cognitive function and it was getting better every day. And so um, it turned out she's done so well. After her burn injury, she resumed and graduated from college. She met her now husband when she was going to school. They're married with 4 children, and I have to say it was a honor and privilege that I was able to go to her wedding. And she actually wore her prosthetics and was able to walk down the aisle. So to me, she was one of my most inspiring patients that really, really made me think, we can't project how a patient's future is going to be because we have no idea, right? And so I think we have to give every patient an opportunity to survive and to thrive.
That's really amazing that you got to witness and also be a part of that transformation. That is very inspirational.
And Claire, can I just add that she's just one of thousands. So that question was kind of hard because I've seen so many miracles, people that shouldn't have survived, lived, people that we thought were not going to have a quality of life have really made something out of their life and did not let that burn injury define them.
Including yourself.
Well, yes, I, 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 I guess I fall into that category.
Let's backtrack and talk more about your journey. So, what inspired you to pursue a career in burn care?
Well, obviously, I'm a burn survivor. And I was burned at age 7, so I was very young. My sister was 12, and we sustained a campfire injury. What we thought was lighter fluid was actually gasoline. So when we poured it in the campfire pit, there was some amber. We'd been trying to light it and it wouldn't light. There was some embers in there, and so it exploded immediately. My sister was 12. And at that time, this is back in 1972, she knew to stop, drop, and roll. And I did it. So I ran and I fueled the fire. So I was burning about 65% of my body. But I was so amazed, even at age 7, what the hospital's like a little city. It's like its own world in there. And my nurses that took care of me were outstanding. They were so good, so kind, gave me choices, and I loved my nurses. So after this incident, I wanted to become a nurse. My mom was also a nurse, but it was really the nurses that took care of me that really inspired me to become a nurse. And I had thought about becoming a plastic surgeon, but then when it came down to it, nurses are with their patients 24/7, and I didn't, I really thought I could make more of a difference being a nurse than a surgeon. And so I graduated from high school. I tried all these other majors. My mom was really kind of pushing me into some other majors. And when it came down to it, I wanted to become a nurse. And I have to tell you, 30 plus years of being a nurse, no regrets. It's one of the best decisions I've ever made in my entire life. And I've had the honor and privilege to care for thousands and thousands of burn patients in my career. Early in the majority of my career in the hospital, but now for the past year and a half, in the community. So it's just been, I feel like my career has come full circle.
Yes, that is very rewarding. And what was nursing school like for you? And were there some more challenging and more rewarding moments throughout your time there?
Well, I won't lie. Nursing school, it was tough. Um, you're responsible for people's lives, so you need to know they have to prepare you, one, to pass the boards, but to be very cognizant of all the safety, all the meds. So it was rigorous, but not impossible. And I really loved nursing school. Just the curiosity and how much I was learning, and I loved the clinicals because every semester was a different rotation, whether it was pediatrics or adults, um, medical surgical, uh, OB/GYN. So through school you get exposed to a lot of things, and I did my last semester in the burn center, and I loved it. Some of the challenges I would say is, it's a kind of a rigorous schedule because you're doing all your classes, but in addition, you have clinicals. So you're in the hospital 2 days a week, sometimes on PM shift, sometimes on the night shift. It depends, just depends where you can get it. Sometimes on the weekends, where the hospitals have available clinicals, and you kind of got to take what you can get. So it was fascinating. It was very scary, because it was hard. So I studied so much because I was determined to learn as much as I could so I could take the NCLEX, and pass that. And I'm happy that I went to San Jose State. They prepared me well. I passed the NCLEX on the first time, and it was very rewarding when I got that notification in the mail that I had passed and I could start working as a nurse.
Can you walk me through a typical day of a burn care nurse and some of the common tasks that you do?
Yes. So burn nursing, is a specialty, and what I liked about it is, especially the burn center came from, it took care of the patients till they were ready for discharge, or they went to rehab. So we got the patients when they would come in extremely sick, critically ill, often have associated trauma. We're trying to save their life. We're doing the fluid resuscitation. So you got all of that critical care. Um, and it, and becoming a burn nurse is also a rigor. It was like I was back in school all again. So, monitoring the patient, monitor in the beginning their fluids. It's a very precise amount of fluid that don't want to give patients too much or too little. So in the early days of a burn injury, really, resuscitating them to save their life. Then focusing on nutrition because it, burn patients utilize so many calories that we have to give them like exorbitant amount of calories because their metabolism is so high. It involves a lot of wound care, sometimes twice a day, 2 to 3 hours if it's a major burn with a large part of their percentage of their body burned, helping them with their splints. And again, what I loved is you really get to know the patient and the family because they're there for months. It's not like a typical ICU where as soon as you get off the ventilator, you get transferred out. Our patients stay because they need further grafting, medications, OT, PT, the specialty of the burn center. And so you really get to know your patients and your families. And so, a day includes assessments, vital signs, medications, dressing changes, occupational therapy, physical therapy, and sometimes just listening. Because as the patients come out of like all the meds we're on in the beginning, they're on drips that are keeping them sedated. And once they start waking up, they might have lost 2 months because they've been in a medically induced, keeping them very calm and still if they're on the ventilator. They kind of wake up and they're like, what happened? And sometimes the magnitude and the severity of the injury is so much for a patient to take. So we do have a psychologist, a social work, and it's really a multidisciplinary team. It really takes a village to get a major burn patient from their injury to survival to home to thriving. And it's OT, PT, nursing, physicians, social services, um, the often the case manager. So it's really a team working together to have the best outcome for the patient. I don't know if I answered your question, but there's a lot involved, and it's kind of hard to explain a typical day. Burn patients go to surgery a lot, sometimes 2 and 3 times a week, and that's hard on their body because there's lots of bleeding, risk for infection. But wound care for sure is a major, major part, whether you work day shift or night shift of burn care.
Yeah, and I can see that's very special because it's so collaborative and you really get to know a lot of people. Like, I think that's something that I'm interested in. I really like interacting face to face and getting to know people. So that's really exciting that you really get to experience that as a burn care nurse.
Yeah. And then some of our services extend past the hospital walls because we have at my former burn center, Santa Clara Valley Medical Center, we have a very active and robust aftercare program, which is a support group for the patients to come back to and meet other burn survivors, a peer support group. So if they want to, when they're in the hospital, they can have either a virtual meeting or an in-person meeting that someone who's already been through it can come in and offer hope and inspiration. We have a burn camp. We do a yearly gala. We do a picnic, and we partner with the firefighters and some other nonprofit organizations. And so, as a nurse manager, we're so fortunate that we have a lot of nonprofit organizations, and we would make sure the kids, there's 3 different camps here locally, I mean, that are like within the Bay Area, and we'd make sure each child, if they wanted to, could go to all 3 camps because that's what the programs are for, and it really helped with their self-esteem being around other kids that look like them, right? They might go to school and they're the only burn kid in school, but when they go to camp, they are like hundreds, like over 100 kids, and they're all burned. And magic happens at that. And so that peer support even starts early with kids.
It's very special. And how would you see the fields of nursing or burn nursing evolving in the next 5 to 10 years?
Well, I think some of the skin substitutes and some of the technology, they're getting so that even the IV pumps are getting so sophisticated as far as um, higher safety checks. The cardiac monitors are getting so sophisticated that we have earlier signs when patients are either getting septic. Um, the skin substitute is just exploding right now, and a lot of the wound care. So we've already seen in my career, I've seen the mortality rate go from much higher down to like 97, 98%. It's a very high, uh, a very low mortality rate where it used to be very high. So in my time in burns, that's one major thing. And uh, nutrition, introducing nutrition and giving people those calories early on really, really can help enhance wound healing and getting people up and moving earlier, way earlier. Like even if they're on the ventilator, we're getting patients out of bed, up in the chair, which 20 years ago you never would have thought to do that. We just would keep people immobilized for such long periods of time that they would get foot drop, they would get contractures, neck contractures, legs, arms. So we are doing things very differently than we did 20 or 30 years ago.
Can you explain more what a skin substitute means?
So absolutely, with burn patients, you need enough of their non-burn skin to try to cover the wounds. Because if it's a third degree or full thickness injury, all of the dermis and epidermis is destroyed. So it's going to require debriding that wound and putting the patient's own skin. So if someone is burned 50% of their body, they still have a lot of areas of their body that we can take what we call donor sites and take that skin, put it through a mesher, which just is a way to, um, it cuts little holes in it and it's mesh. So instead of it being a piece of skin this big, it's this big and it can cover a larger area. If someone is burned 90% of their body, they do not have a lot of choices. So we need something that could create a dermal layer. And then there's even places that can grow skin. If we send a sample of skin, of their non-burned skin, they can grow sheets, but it's very thin. So we really need to replicate the dermis, and there's quite a few products right now. And I can just see in another 20 years, that's even going to get more sophisticated, um, and more better outcomes, right? Which is what we want for our patients. We always want better outcomes. Um, right now, with reconstructive surgery, they're doing a lot. I also see that there's a lot of use of lasers that weren't around 20 years ago, for not only dealing with itching and cosmetics. Um, so laser has come a long way in the last, 10, 15 years. So I can't even imagine um, in 20 years all the things with the research. They're doing so much research in every aspect of burn care, from scarring to what helps with scarring, mobility, contractures, psychosocial, long-term outcomes. um, there's really, it's a relatively new specialty, because burns really got a lot of attention during the Vietnam War because a lot of our soldiers, young 18-year-olds, were surviving these horrific burns and coming back and still alive with the 80% burn. So burn centers really started popping up in the 50s, 60s, and a lot in the 70s of becoming a specialized. There's only about 125 burn centers in the United States. If you compare that to the number of hospitals, so it is a very valuable resource. And when I worked at Valley Med, I used to tell the staff and the community, like, we are so lucky to have a burn center in our community because some states don't have, and some patients get treated, gosh, like 800 miles away from their home. And that's really hard on the family when they have to like move. And burn patients don't get better quick. Sometimes they're there for 6 months, 9 months, a year. And then when the patient goes home, they are away from there's just the all the resources and their burn team because they're miles and miles away. So it is really a very important resource to have access to.
Yes, absolutely. And it is great that like technology is really coming in and going to advance so many things. It's interesting that like I'm not part my internship is on research as well. It's not part of burn care, but the fact that I can see the progress and how quickly it's moving, I'm really excited to see what's to come. So,
Yeah, and there's the American Burn Association is the national organization for medical, and they do so much research. I mean, they have different sites doing research that's funded by NIH on anything from blood loss. So they're also doing some military research. And yeah, it's just amazing. And every year at the annual meeting, all the research that's being done, not only in the United States, but internationally, gets presented at this conference. And it is just amazing, as I said, from preventing sepsis and keeping someone alive to skin substitutes to, oh gosh, just the emotional and the physical healing.
to close our conversation, I would like to ask you for some advice. So, what advice would you give to someone in high school who is interested in pursuing a career in nursing?
I would say absolutely do not get discouraged because we do have a nursing shortage right now, and so a lot of the programs are impacted. Doesn't it doesn't mean you can't do it. It just may take a little bit longer. So just be patient because if if you really want to do it, and realize there's different paths to getting there. I know sometimes people have their heart set on a certain school, and if that doesn't pan out, that their pathway to becoming a nurse is not going to be there. And I can tell you personally, when the nursing program was impacted, even in the 80s when I was at San Jose State, and I changed my major so many times, and schools don't like it when you do that. But I really realized I my heart is in nursing and I need to do this. So when I met with the undergraduate coordinator, she said, you know, the school's impacted. You've already been here quite a few years. You've changed your major. You might not even get in, if you get in 2 years. So I walked out of there even more determined. And to myself, I said, you watch me. I'm gonna get there in a year. So I did every prereq I had. I even did like some of the elective. I just did everything, and I got in within a year. And it's not that easy for everybody because nursing is a lot of people are going into nursing, but I can just tell you it is a very challenging job, but it's so rewarding, and the difference and impact you're going to make. Patients will never forget how kind you were and how you helped them, sometimes for the lowest point in their life, and are so grateful. I have patients come back and say, Jill, I remember when you got me through that dressing change. I remember your advice. And they tell me something I said, and I said that? But the patients like hold on to it. And as a nurse, as I explained earlier, that one of my favorite patients I ever took care of, we have patients we will never forget till for our entire life, you know, because they have touched and inspired us so much. And I think with every patient, it, especially in the burn unit, it makes you want to do better for the next, right? If there's a bad outcome, we try to put everything into place to make sure that never happens to another one, whether it's a hospital acquired pressure ulcer or uh, an accidental, what we call extubation, when people accidentally come off the ventilator. Things do happen in hospitals, but it's always the goal to do better for the next patient. And so inspiring. I mean, I burn care is really hard, but I don't think I would have stayed in it as long if I wasn't just so inspired by the courage, the human spirit, and the watching someone go through this horrific, they're like completely open, they have no skin, to leaving the hospital, getting back to their life, right? Slow steps. Maybe it might take people 2 years to go back to work, but they do go back to work and go back to school or reinvent. Sometimes people can't go back to the same profession that they had. So it's just, I could go on and on about advice, but I think follow your dreams. You spend a lot of time at work, and it should be something that gives you passion and fulfillment and like you're making a difference in this world.
Yeah, for sure. And I appreciate what you said about how even though it's very hard, it's so fulfilling, and also that there's different paths to get there, which is why I'm like trying to interview all these different types of people that work in healthcare in general because there's so many different paths to take. So I really appreciate that you said that.
Oh yeah. And people are sometimes they move out of the area because they can get into a 2-year school. And I say, if you can get a 2-year, you can always go back and do a bridge program and get your bachelor's. But you can go to a really good 2-year program, get your RN, and then go on and get your bachelor's. And if you want to go past that, get your master's. In nursing, there's a lot of people getting their doctorates now that wasn't happening at all 20, 30 years ago. So nurse practitioners, there's that continuing education pipeline. And I always, as a nurse manager, I was always encouraging people to further their education. You know, keep it's lifelong learning for nursing, but keep challenging yourself to get those advanced degrees because it opens up more doors if people want to go on to management or go on to being a chief nursing officer or go on to be a researcher.
Absolutely. And is there anything else that you'd like to share with our audience or any final thoughts you'd like to leave us with?
Just I really appreciate you taking an interest in one wanting to showcase healthcare professions because it really it's so rewarding. And it was tough during the pandemic, but we got through it. And um, follow your heart and your passion, and you'll whatever career you choose. Um, that's the best advice I can give because you spend so many hours at work, and you got to love what you do, and you got to love and just how close you get, you know, especially in healthcare, you're with people during like hot people coding, their heart stops. You're in a high stress environment. And in that high stress environment, you bond so closely with people that it's a team. People have your back. They're going to jump in and help if your patient's crashing. And it's hard to explain that, but some of my closest people in my life are been people I've worked at the bedside with because you just have that bond that I think that's true in the fire service, emergency EMS service, in hospital um, settings. You really get develop that bond with your coworkers.
Thank you so much, Jill, for having such a great conversation with me today. You really inspired me. And for our audience, thank you so much for joining us on another episode of Coffee Chats with Claire. I hope you are inspired too, and see you next time.
Thank you.